In this video, we will discuss various hubs workflows that are available for case investigation and contact tracing in the Dr. Justina application. Some key concepts we'll cover include: what is a hub? A hub is a group of cases or contacts that are associated with a particular industry, setting, circumstance, or vulnerable population. And by the end of this video, you should be able to locate the hub's case lists in the system, understand the types of hubs and how they are triggered, as well as search for a case or contact within a hub. Here, I'm logged in as a case investigator and a contact tracer, as well as a CDPHE user, but most of the hubs you do not need to be a CDPHE user to access. We'll cover a lot of information about hubs in this video, but a far more comprehensive guide to keep in mind is the Case List Logic Feature Guide, so feel free to refer to that after this video. And a general note is that all hubs, except for the Incomplete for CEDARS hub, exclude patients and contacts who have been transferred out of the jurisdiction, as well as patients and contacts that have been transferred to the jurisdiction but are awaiting supervisor approval. All patient lists exclude stub cases and probable cases who have been rejected in the supervisor approval process. In terms of where hubs can be found, there are several that are visible in the application, labeled as hubs. For example, these cross-jurisdictional hubs, or this hub for cases incomplete for CEDARS. There are various hubs down here, but there are also many hub groupings that are not visible as their own icons, but that can be found in the Search All Case Hubs and the Search All Contact Hubs. The Search All Case Hubs is visible to case investigation or PUI or hubs team members, and the Search All Contact Hub is available to contact tracing team members. In this example, we are going to dive into the Search All Case Hubs in order to see what this module looks like inside. We have a search form here, which has some standard fields such as last name, first name, date of birth, etc., but it also has various hubs that we can search for. And so we can select yes or no for a certain case. Let's say if we wanted to look for a case that was in this education-related hub, we could say yes, but maybe we only wanted to look for cases that not only were in this daycare, child care, schools hub, but that also are cases that are experiencing homelessness, as an example. We can select multiple groups or reject multiple groups through this search form. If there's a specific case that you're looking for, you can use the other fields at the top of the form to narrow down your search. We can also submit this, and then we'll get any cases that fit this criteria. And if we wanted to search further within this list, we could actually hit search again here and dive in even deeper. We can also view hubs on a case level by clicking on a case. And here we can see lab results, registered contacts, and notably we also have hubs. In this tab, you can see which hubs this case is associated with. So for example, this case here is in all of the hubs except Incomplete for CEDARS. This probably wouldn't happen as often in reality, but in this staging environment example, here we can see what hubs they are a part of. A few hubs, however, will not be visible in the Search All Cases Hubs list because they actually have their own modules. So for example, here we do not see the Incomplete for CEDARS or the Culture and Language Support hubs, and that is because we see them down here. They actually have their own icon and their own place to search, but all the rest of the hubs which don't have their own icons, we can search through these. So most of the time when you're looking for particular cases or particular hubs cases, we would be using these Search All Case or Contact Hubs modules. And in terms of how a case actually gets designated as being in one of these hubs, I'll run through a quick example. The Case List Logic Feature Guide features far more detail on this, but as an example, I'm going to open up a case here and we can go through the case investigation form for it and see an example. Basically, there are various questions that, based on their answers, can trigger the case to be placed in a particular hub. I'm not going to go through them all in this video, but they are noted in that feature guide. And for now, let's take a look at employment and school information. When we see these blue question mark, which I just clicked on, this indicates a helpful guide to the user to better understand which responses for this question would trigger which hubs. So here you can see the question was, what kind of work or services does your place of employment or volunteering provide? And if we select education, it will trigger the case to be placed in the daycare, childcare, K-12 schools, and the universities and colleges hub. Whereas if we select emergency response or healthcare, those would trigger the healthcare workers and first responders hub. So essentially, if I select one of these options, let's say I select teacher or school worker, that should trigger the case to be placed in a corresponding hub. Also, for this example, if we were to select yes and the case was less than 19 years old, it would trigger the daycare, childcare, K-12 schools hub. And there are many other questions that can trigger hubs, which we can see with these blue question marks. If we say yes here, for example, were you in a correctional facility? Yes, that would put it in the correctional settings hub. So similar things with homelessness and so on. And so this is in the case investigation form, but the contact notification form also contains various questions that can trigger the case to be placed into hubs. I'm not going to submit this now, but if you were to submit that, then the corresponding hub placements would occur so that you would then see this case in the hubs that made sense based on the responses to the question. Going to go back now to the main screen to describe more about two newer hubs, which are cross-jurisdictional hubs for cases and for contacts. These are only visible to CDPHE or DOC users because these contain cases across LPHAs, whereas of course these other hubs only contain cases from your own LPHA, but the cross-jurisdictional hubs are only visible to CDPHE and DOC users. They're available in all project spaces. And these case lists function similarly to the search all case or contact hubs lists, but they actually include records from all LPHAs. These case lists include cases that are associated with long-term care facilities, people experiencing homelessness, air contact investigations, cases assigned to the regional pool user, and DOC cases. Clicking into this will also experience a cool feature. So currently I'm in the staging domain, and these are just test examples. In reality, in regular usage, you would see various other LPHAs in the state available. So I'm in staging, but I'm going to only look in dev, which is a different test domain. So let's say we want to look at long-term care facilities. Yes. And so now when I submit this, I'll be able to see cases in this other LPHA, or in this case, test domain, that are in long-term care facilities. So let's say I click on this Joe Smith, who is in this dev domain. When I click on Joe Smith, once it loads, I actually switch project spaces. And this is a special feature called smart linking. You get taken directly to the case in the LPHA that it lives in. We can see in the URL, I'm now in a different space. So for example, in your state, you might be taken from Boulder to Denver when you're clicking on a particular case. And this really makes the navigation super seamless. And again, it's only available to CDPHE and DOC users who are able to access cases across different domains, but it will take you right to where you need to go. So the hubs are a pretty powerful tool to help find cases that meet particular criteria or are in particular types of environments. And of course, you can refer to the case list logic feature guide as well as the Cross-Jurisdictional Hubs Future Guide for more information. Thank you. Thank you for watching. For additional support, please visit the website linked on the slide.